New at 6, more and more Lyme disease cases are being diagnosed in children.
How families seek treatment will vary depending on where they live. Dr. Maria Simbra has the story.
It used to be rare in this area, but now it's commonplace. The tick-borne bacterial infection, Lyme disease. It usually shows up as a bullseye rash after a tick bite.
If left untreated, it can progress and more commonly involve arthritis, and that can occur weeks to months, sometimes even years after the initial infection.
Researchers at Children's Hospital tracked pediatric patient diagnosis codes for Lyme disease and its associated signs and symptoms from 2003 to 2013. And they correlated medical records, demographic information, zip codes, and where the patients received care. At first, cases were north and east of Allegheny County.
But over time, as the rate of disease increased exponentially, we saw a migration in the cases. The patients were residents of closer and closer to the city.
Turns out kids from rural areas were more likely to see their primary care doctors with symptoms of late Lyme disease, such as arthritis. The suburbs and cities were more likely to be seen in an emergency department for symptoms of early Lyme disease, such as a rash. Other corroborating studies have focused on health department records or ticks in wildlife.
This is one of the first studies to look at patient records in detail over a broad geographic area and over time chronicling sort of the progression of the disease.
The study can't show why the shift is occurring, though it could possibly be related to migration patterns of deer and mice, the carriers the ticks get it from. Dr. Campfield hopes the study findings raise awareness of how pervasive Lyme disease is in our area.
Lyme disease is probably here to stay in western Pennsylvania unless we can come up with some magical way to get rid of, the ticks and or deer or mice, which I don't think are probably going to go away.
Maria Simbra, KDKA-TV News.